Welcome back to the channel where medical topics are made simple. In this video, we're going to talk about how to use Wells criteria for pulmonary embolism, or PE, and what the score means. You'll also learn a simple mnemonic to remember the Wells criteria. And by the end of this video, you'll know everything in this Wells criteria table, and you will learn the why behind everything. There's a practice question at the end, so make sure to watch the entire video. You can find this topic in our book and follow along, which is linked down below. Or you can also find the notes for this video linked down below. So what is the Wells criteria for pulmonary embolism? The Wells criteria calculates the pre-test probability of a pulmonary embolism or a PE. To put it simply, it tells you how likely a PE is prior to any testing. So you're trying to figure out, is a PE likely or is it unlikely? And this can help you determine what kind of testing needs to be done, if any. So what is a pulmonary embolism or PE? It's a clump of material or substance, most commonly a blood clot, that travels to an artery in the lung and it blocks the artery. And we can use the Wells criteria to figure out how likely a pulmonary embolism is. So how does the Wells criteria work? There is a set of criteria and each of them have points. The points are then added up to give you a total score, which gives you the probability of a PE diagnosis. There's a memory trick mnemonic at the end to remember all of this, so keep watching. Let's walk through the criteria and their points, and then we'll learn how to apply it and what the score means. First, we have clinical signs of DVT. A DVT stands for deep vein thrombosis, which is a blood clot that forms in a deep vein, typically in the leg. You may see leg swelling, redness, or calf pain to name a few. If these signs of DVT are present, then 3 points are given. Remember we said a PE is typically from a blood clot in the leg that breaks off and travels to the lung. That's why DVT is included in the criteria. Next, we have PE as the number one diagnosis or equal. If a PE is at the top of your diagnostic list or tied for first, then 3 points are assigned. Next, we have heart rate greater than 100. If the patient has tachycardia, meaning a fast heart rate greater than 100, then 1.5 points are assigned. Remember, a PE is a blood clot or other substance blocking an artery in the lung. This will cause the heart to beat faster from stress on the heart, low oxygen levels, among other factors. Next, we have immobilization for 3 or more days or surgery in the previous 4 weeks. If either is present, then 1.5 points are assigned. The reason for this is both scenarios increase the risk of blood clot formation. Remember Virchow's triad, which are 3 factors that increase the risk of blood clot formation, called thrombosis. One of them is stasis of blood flow. Immobilization or bed rest from a recent surgery can cause the blood to be stagnant, which can form blood clots and cause a PE. Next, we have previous PE or DVT. If a patient has a history of PE or DVT, then 1.5 points are assigned. Next, we have hemoptysis, which is the coughing up of blood or blood-stained mucus from the lower respiratory tract, such as the lungs. Remember, a PE involves an artery in the lung being blocked. This can lead to pulmonary infarction, which is when the lung tissue dies from lack of oxygen from the blocked artery. The pulmonary infarction can cause someone to cough up blood. If this is present, then 1 point is assigned. Finally, we have cancer treated in the last 6 months. If true, then 1 point is assigned. Cancer can increase the risk of blood clot formation. Again, let's go back to Virchow's triad. Cancer can lead to hypercoagulability, which is one of the 3 factors that can increase blood clot formation. Now that we've gone through the criteria, the next step is to add up the total points based on the criteria present. The score gives you the probability or likelihood of a PE. A total score of less than 2 points is low risk for a PE. A total score of 2 to 6 points is moderate risk for a PE. And a total score of more than 6 points is high risk for a PE. A modified and simpler version, called modified Wells, is a score of 4 points or less is PE unlikely, and a score of more than 4 points is PE likely. We can then apply the Wells criteria score to help with diagnosis and testing. A low-risk Wells score, along with being PERC negative, means low risk for a PE, and testing for a PE may not be necessary. So this would be a Wells score of less than 2 points and being PERC negative, which means there is a low pretest probability of a PE. The PERC rule is a checklist used on patients who are already low risk for a PE to further rule out the need for testing. You can watch our PERC rule video linked down below to learn more about PERC. If we have a low risk Wells score along with being PERC positive or a moderate risk Wells score, then this means moderate risk for a PE, and a D-dimer test should be considered. A D-dimer is a blood test used to rule out blood clots. It measures protein fragments released when a blood clot dissolves. If the D-dimer is positive, meaning there could be blood clots, then consider imaging such as a CTPA, which is a CT pulmonary angiography of the chest. If the D-dimer is negative, then further testing for PE may not be necessary. So again, this would be for a Wells score of 2 to 6 points, which means a moderate pretest probability of a PE, or a Wells score of less than 2 points and being PERC positive. Finally, if we have a high-risk Wells score, then this means high risk for a PE, and a CTPA should be considered without the need for a D-dimer. And this is because the pretest probability of a PE is already high, and a negative D-dimer is not sensitive enough to safely exclude the diagnosis of a PE. So directly going to imaging is typically recommended. So again, this would be for a Wells score of more than 6 points, which means a high pretest probability of a PE. You can also use the modified Wells score. PE unlikely is a Wells score of 4 points or less. This would be low to moderate risk for PE, and this can be managed with a D-dimer. Like we said before, if the D-dimer is positive, then proceed to a CTPA. If the D-dimer is negative, then consider no further PE testing. PE likely is a Wells score of more than 4 points. This would be high risk for PE, and proceeding directly to imaging, such as a CTPA, is typically recommended. Here's a mnemonic to help you remember the criteria. And then there's a practice question, so keep watching. You can use the mnemonic picture. The P stands for previous PE or DVT. The I stands for immobilization. The T stands for tachycardia. The C stands for cancer. The H stands for hemoptysis. The E stands for edema or clinical signs of DVT. And the R stands for ranked number 1 diagnosis. Here's a practice question. Try to figure out what the score would be using Wells criteria. A patient presents with shortness of breath and pleuritic chest pain. They had right ankle surgery 2 weeks ago. Their right lower extremity appears edematous and red. Their heart rate is 112. They have no history of PE or DVT. They deny coughing up blood. They have no history of cancer. Hit pause in the video and calculate their score using Wells criteria for PE. Their score would be 9 points. 3 points for clinical signs of DVT with their right lower extremity edema and redness. 3 points for PE as number 1 in the diagnosis for their shortness of breath and chest pain. 1.5 points for a heart rate greater than 100, and 1.5 points for their recent surgery. This would mean they are high risk for PE, and PE is likely. If you found the video useful, please hit that like button and let us know in the comments. You can find the notes for this video, along with our book and flashcards, linked down below. Subscribe to save time studying and not miss out on future videos and notes. Thanks for watching, and hope you return for future videos.